Hey y'all, this is Kayla with What's Brewing, and today I have Dr. Brennan with Rise Chiropractic for part two of his interview. Before we dive in, let's go ahead and roll that beautiful B roll. Well, hello.
Hey, Kayla.
It's nice to have you
Good to
again.
see you. Yeah.
Our part one interview, we kind of talked about how you like to educate your patients and educate, pretty much everyone, like you said, from young age to older age in making the right choice. How do you go about doing that?
Yeah. So great question. We do it both in the office and outside the office. We really want people to be able to make informed decisions for their health so that they can be healthier, better versions of themselves. And so that starts with having the information to know what
Absolutely.
decisions to make, right? So, in the beginning, when we started our practice at the beginning of 2018, we started trying all different ways to market ourselves to get the name out because nobody knew who we were. And the way that ended up working the best for us just organically was by doing health talks and lunch and learns. So we would essentially cater lunch to offices, businesses, local businesses, just people in our community. No group too small. I've talked to people one-on-one, and I've talked to as many as 70 people all at one
That's
time.
amazing.
And the goal was just to spend 10 or 15 minutes to say, hey, here's a piece of information that might empower you to make a really healthy decision for yourself and your family. Do with it what you want. And it was a no pressure situation, but being able to just show up to hundreds of businesses in the area and simply educate on what chiropractic is and why it's important to get evaluated on a regular basis rather than just using it for pain management and things like that
Absolutely.
is what slowly over time accumulated our patient base, our practice member base, and that's where we're at now.
And I feel like probably by going out and speaking to people instead of just waiting for everybody to come to you, you must have built a relationship there.
You bet. So similar to you guys and doing these types of, episodes and interviews, I love this approach because, you have one way you could put a billboard in the Gordon McKernan, but I don't have $4 million a year to spend on advertising.
Man, those are expensive.
Yeah. So rather than, and I'm all for supporting the schools and the local sports teams and stuff. And, having the sign on the outfield is great, but it's totally different that versus literally just saying, hey, Kayla, I'm Brennan. Nice to meet you. I'm a chiropractor. Let me tell you about what that is and hear from you too. And that mutual respect and exchange of information so that we
It's
can.
the knowledge.
Yeah, you bet.
The knowledge. And like you said, be proactive instead of having to fix things later.
Yes.
And so when you given that information ahead of time, you're able to do that.
Right. And I guess, a lot of times we'll walk out of those situations. I mean, of course, we want to gain new clientele from those types of talks.
Well,
We want to take care of
absolutely.
people.
Right.
But, I can't tell you how many I've walked out of and not gotten a client at all. But then 3 years later, they told someone who told someone, and then a family of 7 comes in. So that exchange of information, I think, is the most valuable way to just,
Networking.
yes, exactly.
We touched on that
Yes, we
earlier.
did.
Networking. That's a really, I think that's, like you said, besides paying millions of dollars on billboards, it's so much better to build a rapport
Yeah.
and a relationship with people because, even as a doctor, people are going to choose to do care with you because they like the way you take care of them.
Yep, the different style or the different technique, or every patient has a preference on what type of technique they prefer, and I'm not a fit for everybody. But at the end of the day, what I believe keeps people coming to you is if they like you or not. So if you're treating people well and building a relationship with them, hopefully you can take care of them for the rest of their lives and their family's lives. Yeah.
And so what if a new patient walks in, just hypothetically, I walk in, what, how do you choose the best method for that patient?
Yeah, so we perform a full evaluation. So first we're going to show you our office. We like to show off.
Oh, you
Show
like to
where all
tour?
the stuff is at, the tour, yeah. And then we're going to give you an education on what we do. We'll take a history, and then we perform evaluation. So we use infrared cameras to basically roll up the spine, and it shows differences in temperature along the spine. And that's basically the way that we narrow our approach down. So we don't put people on tables and just start racking and cracking stuff.
Okay.
Our goal is not to just mobilize all the joints of the spine. Our goal as chiropractors is to remove nerve pressure or nerve irritation. Most of the time, if the bone in the spine is not moving properly, you'll start to get a buildup of fluid or edema. Call it inflammation if you want. That's what's going to irritate the nerve. And so we want to figure out exactly where that's going on and what the correct way to reposition that vertebra is, or getting it moving a certain way is. So the thermal camera points us to where the nerve irritation is, so that we can leave all the stuff that's not irritated alone. So earlier I said less is more.
Right.
So after the thermal, then we do x-rays, and we can actually see the health of the discs. We can see the posture and how everything is compensating and working together. And then we'll go in and palpate. So quite simply, we use our hands. That's probably the best skill that I have that makes me unique as a certain type of practitioner, is my hands, is just being able to feel very subtle, nuanced things to know that's abnormal or that's normal, and work on the stuff that's abnormal and do it in a way that's going to allow the patient to get better, rather than doing too much at once. We don't want people leaving too sore, but we want to get the job done. And if I can find the root cause of the whole problem, that's my goal. It's
Absolutely.
not always that simple. Sometimes things are more complex, but the goal there is to take all of the information from the history, the thermal scan, the nerve assessment, the x-ray, the palpation exam, and narrow it down to that one or two things. Yeah, what started this whole compensation ripple effect in the body? If I correct that, okay, now watch the whole ripple effect disappear. I can't tell you how many times I've had to boil it down to an ankle or a hip, and somebody comes in for headaches, and by the time we work through the whole thing, it's like, it's not their neck, it's not their mid-back, it's not, oh, their hip was a little out of whack. That set the whole thing off. As soon as we got the hip set, everything
Well, my
started to come
goodness,
back
maybe
in.
you can cure my headaches.
I don't know, maybe so. We'll have to take a look.
I would love for you too. Man, learning about chiropractic care has been really interesting. Thank you so much for sitting down and talking with us. I even worked for a chiropractor for years, and the approach that you guys take and that Rise takes and the way you build relationships, and you're a family-oriented business, has really, it's been a pleasure learning about how you guys got started, where you're at, what you do for the community, and just the approach you take with your patients.
Well, thank you so much for highlighting us. Appreciate you.
Thank you for coming. It's been our pleasure. Thank you so much. If you like what you saw today, please click the like button, go ahead and crush that subscribe button, and don't forget to click our notification bell so you don't miss a thing we have coming your way. Until next time, I'm Kayla. Y'all have a great one.